is all kind of lavender colored because this blood is all somewhat deoxygenated. Where is the oxygenation happening in the fetus? In the placenta, right. So the blood's coming back from the placenta up this way. All right, so we're not really oxygenating via the lungs. What the lungs are doing in the uterus towards most of the pregnancy is developing. They get done around 32 weeks or so. They can support life at around 24 weeks. Sometimes we get babies that are 22 and they do okay, they make it. But generally before 24 weeks is really hard to sustain. And the reason is this. The circulatory structures are coming from one set of embryonic tissues and the lung structures are coming from another set. They're not right next to each other. And what happens is that these keep growing towards each other to the point where the capillaries will wrap around every single alveolus so that there's only one cell between the airspace and the blood. All right, just one cell. And so that makes diffusion of gases really easy. So the lungs are basically just growing and doing that. Towards the end of pregnancy, they start making surfactant, and I know Mrs. Longbottom talked about you gotta have surfactant to keep the alveoli expanded. Otherwise, every time the kid breathes out, the alveoli collapse because of surface tension, and the baby has to open them all up again. And you know how they cry in delivery, they really have to let loose, and that's a lot of work. As they're doing that, they're opening more and more alveoli, and those stay open because of surfactant, so that once they get enough of them open, it's not as much work to breathe. For a baby without surfactant, they cannot keep those open because of the surface tension in the alveoli. So what happens is that after they breathe out, every breath, they collapse again. So every breath they have to keep reopening them. That's a lot of work, and the baby can only keep that up for so long. All right, so we have blood that isn't like really well oxygenated because it's not actually coming from the lungs, it's coming from the placenta. By the way, does anybody know what the PO2 of blood in the placenta is on the fetal side? Well, babies have to have lots of oxygen, right? So should it be 90 to 100%? Surprise, it's 45 to 50%. And that's why when the placenta gets compromised, the baby crumps, right? Okay, there's not a lot of give there. By the time the mother's blood gets to the uterus, it's already gone a number of places. And so it's not 90 to 100% there. All right, so babies in the uterus are functioning on a much lower PO2 level than what we would expect in a baby that's outside and born and away from the mother. All right, so blood's coming back this way, and it comes into the right atrium. It's also coming back from the brain. Not a whole lot of it is going this way. Most of it's coming this way. And so some of it will go into the right ventricle and up to the lungs. That is the minority of the blood. It has to go to the lungs so that the lungs can develop. It needs the blood to grow and to mature the cells, but it doesn't need a whole lot of it. It can't even handle a whole lot of it. So most of the blood, when it comes up here, winds up going across a structure that is in the septum between the atria, and it just passes right through it. It's a shunt. It has a little piece of tissue on the left side that works like a door. Every time the flow's coming this way from right to left, this little door it's a tag of tissue, kind of opens. It's called the foramen ovale, and that is there because you don't need to send all that blood to the lungs because the lungs aren't oxygenating the baby. This blood has already been oxygenated. It goes to the left atrium, to the left ventricle, and out the aorta, to the body, to the kidneys, to the liver, to the gut, to everything that is maturing in that baby that needs oxygen. Sending it to the lungs would be a waste, right? Because it doesn't need to go there. Some of it does to help the lungs develop it, a very small percentage. So the point is to get the oxygenated blood out to the organs that need it faster. So it goes through this foramen ovale. That's a normal structure, and we expect that at birth that something will change about that structure because it's not going to work to skip the lungs, right? After birth, you don't have a placenta, so after birth you have to depend on the lungs. All right, so the blood that does go to the lungs comes back through the pulmonary arteries into the left side, and then it goes out to the aorta. There is another shunt, it's a lot smaller than the foraminal valley, and it is right there. And it is a shunt between the pulmonary artery and the aorta, which is coming from the left ventricle. See that little doodad right there? Okay, that is an additional shunt. When you have blood going past the lungs, it's not gonna go into the lungs, it's gonna go through there. There's very high resistance in the lungs. It doesn't want to let circulation go there. It's busy growing and maturing, but it isn't there to let a lot of blood through to get oxygenated. It's not ready for that yet. So there's a lot of resistance. So any blood that does go up the pulmonary artery, there's a lot of pressure in here, and it'll go into the aorta. So it's another way to skip into the circulation faster. All right, so the two shunts do the same thing. They move blood through the baby's heart, and pretty much of it skips the lung, because the lung is not useful for oxygenation at this point. And the heart's very effective at turning it around and getting it out to the organs, so that the organs can get enough oxygen out of this fairly low oxygen tension blood. Does that make sense to everybody? Are we all together? Okay. All right, so some things that happen when the baby takes his first breath. He comes out, and what does he start to do? He starts to scream, right? Deep breaths. And when he takes those deep breaths, those alveoli, which are all kind of crumpled up with all the capillaries kind of, crumpled up around them, they expand. And as they expand, the capillary net around each of them, very, very tiny, straightens out and isn't as knotted up. It becomes so much easier for blood to go there because there's not as much resistance to flow through an open circuit that's smooth than through a circuit that's all kind of, knotted up. So blood will start going to the lungs, and most of it will go to the lungs. And so with the adult heart, you expect that to happen, right? So it goes to the lungs, and as the majority of it starts coming back into the left atrium and the left ventricle, the left atrium pressure now goes way up. In this heart, the higher pressure side is the right side. The low pressure side is the left side. If you think about that, that's exactly opposite to what it is in the adult, right? Right. In the adult, the left side is the high pressure side. All right, so different in the fetus. The high pressure side in the fetus is the right side, pushes blood to the left side through that foraminal valley in the septum between the atria. All right, so at this point, you have much more blood coming back. The baby is continuing to scream. He's opening more and more alveoli. And as that circulation kind of opens up and becomes smoother, the lungs can accept more. And as they accept more, they start putting more towards the left atrium. This then will close the foraminal valley. The foraminal valley is only a one-way circuit. So stuff in the blood in the baby can go from the right to the left side through the foraminal valley, but the way it's built, if blood tries to go back this way, after it changes, it just shuts it. It's a tag of tissue, and the flow can only go one way through it. If it tries to go the other way, it shuts that piece of tissue, and there's no way to get back through. All right, so the foraminal valley closes. It takes about 6 weeks for it to close completely. It grows closed. And that's what's supposed to happen. You're not supposed to have a shunt between the left and the right atrium. Some babies never close that completely, either because they keep trying to rely on a placenta that's not there anymore, or because they haven't grown the right tissue. The tissue isn't complete and it won't obstruct that opening completely. Are we together?
What happens to a baby when that doesn't close all the way?
Then you start having shunting going left to right. It's a really good question. Because the pressures on the sides of the heart changed, when you open the lung circulation, this side becomes, right side becomes low pressure, left side becomes high pressure. You start having blood shunting back this way, from left to right, because that piece of tissue didn't close completely. The foraminal valley is supposed to totally obstruct that opening.
How does that present in the baby? Does it have a murmur, or?
It depends on how big it is. Little teeny ones don't, really big ones don't. because a murmur is made by blood mixing, and so you wind up with medium-sized ones having a murmur, but there isn't enough blood, rolling around with unusual current. I guess that's the only way I can describe it. I'm thinking of like a whirlpool in a river or something. Has anybody kind of seen that? That would make noise. But if there's so much flow going back and forth and no obstruction to it, you're not gonna hear a murmur, and you're not gonna hear a murmur from a teen spleen, okay?
So if it doesn't close all the way, do they need like surgery to have it closed?
We'll talk about that. A lot of them will close themselves over time, which is kind of new, and that's exciting because then that's a lot of heart surgeries that don't need to happen. Okay, so here we are, the baby's born, starts screaming, opens the alveoli, blood wants to rush in there because now it's so much easier to flow there. Comes flowing back to the left atrium, left ventricle, goes out the aorta. As the baby continues to breathe, the lungs are so much more efficient than the placenta. Our sats are running up. They usually start at around 60 when the baby's born, but then they rise slowly. When I was working in OB a long time ago, if the baby wasn't, 90% right after birth, we're gonna put oxygen on him and start, getting him up there. They have found it is much more physiologic to let the baby raise himself from 60 to 70% to up in the 90s. And as long as he's making progress going that way, we're not gonna probably put a whole lot of oxygen on him. Definitely not gonna bag breathing. We used to do that. But it really isn't physiologic to have that gas change that rapidly. The baby will take care of that. So your job as a nurse is to keep watching to make sure that the baby's going in that direction and getting to the 90 to 100% as he continues to breathe oxygen with his lungs and to oxygenate more and more because more and more alveoli are opening. Does that make sense? Okay. All right, and the reason I keep asking that is because if you get lost, then what comes next is really gonna get lost. So I want everybody to make sure to,
I have a question.
yeah, what's going on?
When I did the book, I think there's somewhere they say most of 75% of the baby they have a hole on the heart. Where is it?
Tell me again, the baby has a hole in its heart.
75% of the infant.
So there's a lot of places you can have shunts. This one, this patent ductus arteriosus, this is a great thing because it helps additionally take blood that was on its way to the lungs and just bypass the lungs and go to the rest of the body so that we can get the best oxygenated blood in that system out to the organs. But after the baby starts to breathe, then we really don't want that to happen, and this should spasm within maybe 2 to 6 hours, somewhere in there. This should spasm enough that it will essentially close off. And if the baby is stable and doesn't get hypoxic in the neonatal period, it will actually turn into a ligament. It will degenerate into a ligament that can't open, all right? But in the fetus, it's actual tissue that lets blood pass. After the baby's PO2 reaches around, I think around 80%, 90%, this will spasm. It is a response. The spasm is a response to the rising PO2. Does that make sense? Okay. So that can be a shunt. That can be a hole. Not supposed to be. So it just depends even on where it is. Sometimes the hole is a fetal structure that should have closed off, like the foramen ovale or the ductus arteriosus should have closed off, but it didn't for whatever reason. Now, when we talk about prematurity being the primary cause of death in the first year of life, this is one of the reasons why. If the lungs aren't ready, then the resistance in the lungs to blood flow stays high. Blood needs to skip, it will continue to skip the lungs, but we don't have a placenta anymore. That premature baby is no longer in the uterus. The placenta has been cut off. And so that becomes, the left side becomes the high pressure side. And we have a situation now where there's nothing that is oxygenating that baby. And so the baby depends on those shunts. And we actually give preemies, young enough preemies, we give them prostaglandin infusion in the nursery to keep those shunts open, because that's the only way we can really oxygenate the baby, okay?
I have a question.
Yeah. So, anyway, this makes a lot of sense. what supported the baby in the uterus is the placenta, right? Mrs. Longbottom draws the inside of a placenta, and it looks like little fountains that are, you know, squirting down and running around the base of the fountain and then draining out. Did she draw that for you guys? Oh, I'm gonna beat her up. Really? Okay, well, the placenta is it's kind of an open circuit. You have the little arterioles just kind of spurting like fountains into this space. And then there's like a collection area to it, and then it drains away. And so it's not high pressure, it's very low pressure. So during fetal life, the left side is low pressure because it's got this big area that's kind of just free flow in that placental bed. However, when that placenta gets cut off, then this becomes the high pressure circuit, and that's what it is in adults, right? The left side is the high pressure side, the right side's the low pressure side. Well, that's when it happens. That's the change. It changes because, number one, the lungs open, the circulation opens to the lungs, and it becomes an easier place for blood to go. And so that drops out the pressure on the right side. And at the same time, you've got the placenta cut off, so that nice big kind of open fountain space within the placental bed is removed. And so what's left is a high pressure side. And so the left side becomes the high pressure circuit. And that's why adults circulate like they do. Does this make sense? Okay. All right, so it all has to do with, is the placenta there and are the lungs circulating? Both of which change at birth in the healthy baby, right? Healthy baby starts screaming, alveoli open up, the circulation around those alveoli becomes much easier for blood to flow through, the resistance in the lung drops, and so then blood wants to go there. When it goes there, this side of the heart becomes lower pressure than it was when it was real hard to flow there. And then the placenta gets cut off, and so the pressure in the systemic circuit becomes higher, and that backs up to here, which makes the left side higher, okay? All right. It's kind of interesting. Now, when you have a premature baby, they're born, so the placenta gets cut off, but if the lungs aren't ready to breathe and exchange oxygen, if they don't have surfactant, they won't expand and stay there. Like I said before, with every breath, those alveoli collapse. And every time that happens, the pulmonary circuit becomes higher resistance and much more difficult for blood to flow through. That ain't gonna work. Something's gotta oxygenate the baby. And if we don't have a placenta, it's gotta be the lungs. But if the lungs won't let blood come to them because they can't stay open, and they're just high resistance, and they don't allow blood to flow there, we're in a real pickle because there's nothing to oxygenate the baby. So when a baby's born prematurely and we have that situation, they keep trying to use the foramen ovale and they keep trying to use the ductus, but it still doesn't work because there's no placenta that's functioning and the lungs won't allow enough circulation that the baby can oxygenate his body and his organs appropriately. Did that help? Okay.
Does blood then like back up into the heart?
Right side to remain high pressure. It's really hard to circulate. Yes, some of it's going through, it's going through the pulmonary artery, but it's really not easy for that to happen. And so blood keeps trying to go through the foramen ovale. Because not much blood is going to the lungs, this side never really becomes higher pressure. Because it becomes higher pressure because all of a sudden you got this big volume from the lungs coming back to the left atrium, and that actually slams the door on the foramen ovale. Does that help? Okay. All right. So the baby needed to have these circulation changes. They need to change the organ that's oxygenating. They need to change the pressures on the sides, the different sides of their heart to reverse those. And if the baby cannot keep his lungs open, that isn't going to happen. So he keeps trying to use those shunts, but it's not effective. So the foramen ovale in that case keeps opening. And the ductus stays open. And over time, that ductus will stretch and stretch and stretch and stretch because it's really not a very muscular structure. It's kind of a very thin-walled structure. So it starts getting bigger and bigger and bigger. And sometimes they have to go in and tie that off in a baby that it doesn't close, because it starts making the flow dynamics really bad, because you keep sending blood from here to here, right? So, it can really back up on itself. But the main way to understand it is, where's the high resistance, where's the high pressure? In the uterus, the lungs are the high resistance circuit, the placenta is the low resistance blood circuit. So in the uterus, the right side of the heart is high pressure because of that, and the left side is low pressure. Once those lungs open up and allow circulation to go there, that provides enough blood coming back to the left side for the left side pressure to become greater than the right. And in the meantime, the placenta is cut off, which again allows more pressure in that circuit. Does that make sense?
So, are you trying to say